Hello, my name is Leigh Asheri. I'm a registered nurse who has a specialization in cardiovascular intensive care unit. But at this time, I'm not working at bedside. I have retired from bedside. I'm a case manager now for PASS program, and I'm covering British Columbia and Yukon. As I and myself, I know there's so much information we send to our clients, and there's so much information out there, and we refer them to partners, especially with PASS. But the most, I think, to me, that's what I really benefited from. The most important service is one-on-one with case manager. You need someone who can hear your story. You need someone who can be there for you anytime, because when you have questions, you need someone where you can bounce to and ask those questions. And they may not have answers. They help you to look for answers. They will guide you. So that is a very, very important one-on-one meeting. It may be one, the first one, it may be 10. I have had 6 meetings with some clients because they know how important it is. They will just email me, Leigh, can we have another meeting? It's like, yeah. So yeah, that's very, very important. Journey becoming a nurse in Canada as IN is not easy. And most of you come here while back home you are specializing, you are a manager. So you come here in Canada, you have to start from entry level. It's not easy. And so many times, even myself, I wanted to quit. But always remind yourself, why did you come? And also make sure that you have support system, because without support system is not easy. And also take some time to smell the roses, because it's very, very important. My fellow INs, this is a nursing week and is a celebration. This is a reminder that every day we need to identify those small, small steps we are making in our journey and celebrate, because celebration, it gives us the boost, it gives us the energy to continue working hard, focusing on our goal, and being those nurses we want to be and achieving our goals.
Florida. Always good to have somebody who has your back. Welcome, everyone, and thank you for joining the Care Center for Internationally Educated Nurses Nursing Week 2026 online event. My name is Ruth Wychuck. I'm a registered nurse of more decades than I care to remember, in a variety of capacities, from frontline practitioner to a community nurse, administrator, educator, and now I have the privilege of being the professional practice lead at Care Center. I hope you're all enjoying Nursing Week so far. I'm particularly excited about today's program because it focuses on my practice area, community nursing. Need I say, it's the best. The presentation will begin shortly after our land acknowledgement and inspiring words from our keynote speaker. We acknowledge that we are gathered on the traditional territories of Indigenous peoples who are the past, present, and future caretakers of this land we call Canada. We acknowledge that we are gathered today virtually with participants attending from coast to coast to coast on the ancestral and unceded territories of First Nations, Inuit, and Métis peoples. We respect and affirm the inherent and treaty rights of all Indigenous peoples across this land. We recognize that we each have a role to play in the path to decolonization and mistakes of the past, and to consider how we each can, in our own way, move forward in a spirit of reconciliation and collaboration. And I ask each of you to take just a moment to think on your own journey. We're all immigrants to this country. So take just a moment to reflect on that. Thank you. And now I'd like to say a few words about our recorded keynote speaker, Dr. Leigh Chapman. Dr. Chapman was named in 2023 as one of Maclean's top 10 healthcare innovators and one of the 50 most influential Torontonians. Dr. Leigh Chapman is a leader within the field of nursing and healthcare. She's a registered nurse with over 20 years of experience. Over this course of her career, Leigh has gained a deep understanding of nursing through her work in both frontline and clinical leadership capacities. Her professional experience spans various settings, including clinical care, education, research, professional practice, administration, policy, and advocacy. Wow, what a career. After obtaining her baccalaureate degree, which Leigh completed a master's in clinical health sciences from the nursing graduate program at McMaster University, and then completed her doctoral work in 2019 at the Lawrence Blueber Faculty of Nursing at the University of Toronto. Her research provided key insights into ways in which the regulation of health professionals intersects with organizational priorities in acute care settings. As Chief Nursing Officer, Leigh recognizes the important contribution of nurses at the federal level and aims to ensure their integration into decisions impacting the profession. Within her role, Leigh provides strategic advice from a nursing perspective on priority policy and program areas. She plays a convening role with provincial and territorial governments, with federal departments, regulatory bodies and at colleges, educators, and others in key nursing roles. Additionally, Leigh represents the Government of Canada at public forums, both within and outside of Canada. Leigh is committed to advancing the nursing profession in Canada and to ensure equitable access to both quality care for all. Could we ask for a better person to be representing nursing in Canada? Now we have the privilege of hearing the recorded message from Leigh.
Hello, everyone. Bonjour tout le monde. My name is Leigh Chapman, and I'm the Chief Nursing Officer with Health Canada. Je suis l'infirmière en chef du Canada. I'm delighted to be wishing you all a happy Nursing Week. This year, the theme for National Nursing Week is the power of nurses to transform health. And when we think of internationally educated nurses, you are choosing Canada to transform our health systems from coast to coast to coast. So I really want to applaud the work that you're doing in a variety of sectors, in a variety of settings, and in a variety of organizations and even jurisdictions in Canada. You are a vital part of our health workforce in Canada, and we welcome you and thank you for choosing Canada. I hope that you all take time this week to celebrate the nursing profession, to acknowledge the important work of your colleagues, and to celebrate the profession. All of you are making such an important contribution to the health of people in this country. And I really want to thank you and wish you a very happy Nursing Week. Merci beaucoup tout le monde. Thank you.
Wonderful words from Dr. Chapman, and we thank her for her continued support of Care Center and nurses across Canada. Before I introduce today's moderator, I would like to encourage everyone to use the Q&A button in Zoom to ask questions during the presentation, as there will be a brief Q&A period will take place at the end of the session. Now I would like to introduce today's moderator, friend and colleague, Lourdes Vicente. Lourdes is a registered practical nurse and a certified career development practitioner, currently serving as both a case manager and employment engagement lead at Care Center. With more than 15 years of experience at Care Center, she's dedicated her career to supporting internationally educated nurses in career development, employment support, workplace integration, and professional mentorship initiatives. It's all yours, Lourdes.
Thank you, Ruth, for the introduction. Hello, everyone. Happy Nursing Week to all of you. And we are now on day 3 of our Nursing Week celebration. Explore careers and community and home care with Caring Touch. So I hope you're doing well and enjoying the Nursing Week. And today, we are delighted to have Caring Touch Home Health Care. And they are here today to discuss community and home care nursing and your role as RNs and RPNs as a community and home care nurses. Thumbs up if you're interested or are considering to work in the community, or show some heart or love. There you go. That's great. So Caring Touch holds the privilege of being a first choice home health care provider. They began with a simple belief: everyone deserves to feel safe, supported, and valued at home. For the past 15 years, they have grown from a small team with big compassion into a trusted provider serving families in the GTA and surrounding areas. For today's agenda, and we're so excited about it, so we have 3 sessions actually. We have an online session, which is this one that you're attending to, and we also have Care Center members at Caring Touch office for 2 additional in-person sessions. The first one is they have the virtual dementia tour, which is a simulation immersive experience, and also a pre-screening tour, a session, basically when they get to speak with Caring Touch human resources staff to explore possible opportunities in the community. So don't worry, so for some of you who are interested to explore opportunities with them, just apply or send your application to your case manager, and for sure we will send it to them directly. So before we move on, let's say hello to the participants who are already there, and also Holly Bess, one of our case manager, are present at Caring Touch. Maybe we can show them, like Stephen. Maybe you can show the group. It's like what we were doing a while ago, practicing moving the screen. Maybe, oh, there you go. There you just stand. That's Holly, one of our case managers. We have at least, I believe all of them are there. 9 of our IENs who are present at the location today. So thank you guys for coming. You all look great. Happy to be there. So enjoy your sessions today. Thank you so much. Before we continue, I'd just like to also welcome our Executive Director, Rola Mubader. So Rola, if you'd like to say a short message to our audience today.
Thank you, Lourdes, for reminding me a short message, because I can go on and on and on. I love that. Thank you so much. I just want to say Happy Nursing Week. And I got the opportunity as well to be introduced to the amazing work of community nursing. And I worked for VUN as a consultant for 1 year. I didn't get the honor to be a vet at the community as a clinician, but I supported the clinicians and the nurses and the other healthcare providers in the community. So that's I could say it's an honor. It's something that I can put on as a badge and say I had the opportunity to experience community nursing and community health. So for all of you who are still exploring, please go ahead, enjoy this session today. And also I would actually extend my kind of gratitude to the team who are working behind the scenes to make those actually full week, 4 days of events very kind of impactful and empowering and inspirational. And for Stephen Ham and the Caring Touch team for always being welcoming and also supporting in our kind of, I would say, the advancing of the career of IENs in the community. Stephen, it's not going to be the only one that you're going to offer this simulated visual game with AI on the way. So we're going to actually kind of be asking you for more sessions like this to get the opportunity to other IENs to explore this. So I'll keep it short. Thank you all and have a great session.
Thank you, Rola. So now I'd like to introduce today's speakers. We have the business manager at Caring Touch Home Healthcare, Stephen Ham. Stephen has been with Caring Touch Home Healthcare in various capacities since 2022. As a business manager, Stephen contributes the business development, finance strategy, HR, and compliance needs of the company and is passionate about how healthcare transformation can lead to better health outcomes for patients. Previous to joining Caring Touch, Stephen worked as a management consultant for over a decade, providing strategic financial guidance to a variety of small and medium enterprises, ranging in fields from retail to education. Hello, Stephen.
Hello, how are you? How is everyone today?
We're happy to see you.
Happy Nursing Week, everybody.
Happy Nursing
Everybody,
Week.
happy Nursing Week.
Yes, thank you. So for our next guest speaker is the operations and strategy manager at Caring Touch, Melker Mangubat. Melker is a registered practical nurse and a graduate of Hamburg College with over 15 years of healthcare experience spanning long-term care, retirement, ALC units, and home care. Currently serving as operations and strategy manager, he oversees daily operations while driving strategic growth initiatives for the organization. His clinical background includes working with clients across the lifespan, while his leadership style emphasizes mentorship, innovation, and relationship building. Welcome, Stephen and Melker, and happy Nursing Week to both of you. Again, we're so fortunate to have you with us today. And also, I believe you also have a guest, IEN staff later on that you will introduce to talk about a little bit about their experience working for Caring Touch. And again, thank you for taking time to join us and share valuable information on community and home care nursing. Also, again, for welcoming our IENs at your location and for our in-person sessions. So, Stephen and Malker, the floor is yours.
Thank you, Lourdes. I'm just going to transfer to the PowerPoint presentation now. And I'm going to start sharing my screen. Oops, here we go. Here we go. Can everyone see that screen? Oh,
Yes.
okay. You don't see the notes section at all?
No, we see your notes.
Okay, so just display setting. How's that?
Perfect.
Perfect. Okay. Well, thank you. I just want to say that was a wonderful lead up to this conversation. I'm very happy to be here. I'm very proud to work with Carrie Ian because you guys are doing fantastic work. I'm looking at the group of nurses with me right now, and they're an amazing group of people. And I'm sure the other 70 or 60 odd people that are joining us today are just as fantastic. So I'm gonna go into the presentation right now. I do ask for questions to be put in the chat, and we can discuss them after in the Q&A section. And that's also when we'll be having our guest IEN. They'll be doing their testimonial. So just a little bit of background about the agenda for today. So a little brief about who we are, a little bit about the two streams of community home care nursing, what that looks like in practice from a home care perspective with Caring Touch, the importance of nursing in the Ontario healthcare system, and the typical challenges the nurses face in that when they operate in that healthcare system, and also what the government's doing to respond to those challenges. It's a bit of a mixed bag in that response, but it's something. You can see that the government is trying to take some initiative in that, and of course, the future of nursing in Ontario. And lastly, because it is a job component for today's presentation, how to successfully land a job interview at Caring Touch. So just a little bit about us, because you might be wondering, well, who's Caring Touch and why are they here talking to us about home care? So Care in Touch is, like I said, has been in business for over 15 years. We primarily focus on home care, and we work with the general principle that people care for people, and that continuing care leads to better health outcomes. I don't think too many people would disagree with that, but it's a case where, especially when there's often interruptions with the community to continue with care, that's when people suffer and they have to be readmitted to the hospital. We service a wide group of individuals from pediatric to geriatric and across a variety of instances. So workplace injuries, workplace motor accidents, and new Canadians, refugees. We service a large number of refugees in Canada. They're a very vulnerable population, and it takes a particular skill set to work with that group of people, especially in terms of language skills. You can imagine just how many people come from around the world. But we always try our goal is always about meeting the needs of our clients with respect and dignity, regardless of what type of age or clientele they're from. So we offer a variety of services. Just for a little briefly, home care, obviously. Our Flourish Day program is our adult day program for those suffering from cognitive impairment, which runs Monday, Wednesday, Friday, and it's very, very good because it also acts as respite care for the primary caregiver, which, as many people know, primary caregivers are experiencing record levels of burnout. We also offer foot care in terms of federal health program for the refugees, and we're also getting into medical equipment supplies because in the past there was some supply disruptions, especially right after COVID, which really impacted some of our clients. So we said, you know what, we're going to start doing the supplies ourselves. So that's what we did. So just a little bit about home care. In terms of obviously the ADLs, what's involved for clients, meal prep, light housekeeping, medication administration, because we are nurse managed care, and we specialize in dementia and palliative care. We also do living care, and there's something out there called the family managed home care, which not many people are aware of, but it basically allows the family to expand the number of hours they get because they get the funding directly instead of going through OHA. So I mentioned briefly about the Flourish Wellness Program. I do say that this is an excellent program. It's actually partially inspired by cognitive behavioral therapy because the idea was that by targeting different parts of the brain, we can actually slow down or at least delay some of the symptoms of dementia because it actually literally it hits like visual, audio, creative, the left side and the right side of the brain. So it is quite effective. In terms of our service area, we service a very wide geographic area from basically Niagara, if you imagine around the base of the Golden Horseshoe, to Bowmanville and all the way up to Barrie. We do a service outside those areas, but that's on a case-by-case basis. And we work with a wide number of health hospitals and healthcare partners in clinics in the GTA. I think we're up to roughly about 46 hospitals and clinics and healthcare partners. So we've got a lot of experience. We often get a lot of the discharged patients from those hospitals. So our nurses are exposed to a wide variety of situations, especially that you wouldn't normally see in some environments. We work with a large number of education partners. We do a lot of training. We do a lot of interns. I think in the past 5 years, we've basically interned about 450 internships. So that's over with working with York, Sheridan, Humber, Trios, Seneca. There's about 5 other colleges we work with. And again, it's all about giving back to the healthcare community. We want to increase the supply of workers because the more nurses and PSWs out there, the better, the less strain that's on the healthcare system. And of course, we also provide research opportunities for cutting edge technologies. There was one we did in terms of not too long ago regarding fall prevention technology, because that was one of those things at home care, especially where when people fall, sometimes they may not be able to be getting to the alert button. This software would automatically detect. It was like a bit of a gyroscope in the equipment that would detect when the elevation of the person had changed. We work with a lot of community groups. We really believe in being an advocate for seniors issues and other healthcare issues in the system. We work with PEPAN, which is basically Peel Elder Abuse Prevention, CARP, Peel Council on Aging, Mississauga Seniors Council, the Alzheimer's Society, and of course, Care Ian to increase the number of nurses, right? And to help foreign trained nurses get integrated into the Canadian healthcare system, which is really, really important. You guys work hard. You deserve every opportunity you can to use your skill sets. So that's enough about us. Let's actually get into the meat of the presentation. Let's talk a little bit about community and home care nursing, what it is, what kind of roles when we talk about it, and how it fits into the Canadian healthcare system as it exists right now. So just a little bit about the community nursing. Community nurses play a central role in strengthening Ontario's healthcare system by delivering care outside of hospitals. A lot of the time when people think nurses, they think acute care in the hospital setting. But I would argue moving forward, community care would be the norm, especially because it's first of all, we don't have enough hospitals and the demand for nursing services is increasing, which I'll touch on a little bit later in the presentation. But I would say moving forward, the demand will actually be mostly in the community. They do a wide variety of roles, such as prevention, education, and chronic disease management, and of course, home care. And they support a wide variety of clientele. So, in terms of where you think about where community cares might be working, patients' homes, obviously, but also public health units, schools, community health centers, CHCs, and mental health and addiction services, among other areas. And of course, they include the full gamut of nurses from RPNs all the way up to nurse practitioners. So again, we talked about some of those common duties: wound care, medication management, chronic disease monitoring. Now, the key thing is also, I think, when it comes to, that's kind of not really stressed about too much, is the Indigenous and rural communities and closing the accessibility gap. A lot of community care nurses go into the more distant geographically remote areas providing care, which would be very hard to do for home care nurses in private home clinics. But so they are serving a very, very diverse community over a diverse geographical area. And like I said, in terms of the populations they serve, seniors, families, mental health is also one of those big things that's really becoming in demand because obviously right now we're going through some tough times economically. A lot of people are coping that with a variety of maybe not the best coping mechanisms. And mental health is becoming a very, very serious, and I think with increased awareness, another area of growth and demand. So when we talk about home care nursing, it's very, very similar to community care nursing, but it's slightly different. And that when we talk about home care, it really is about delivering care where the person lives. So it could be the home, could be a retirement home, a long-term care home, if it is a specialty for that, but it's wherever the person is. And to focus on helping people recover from illnesses, manage chronic conditions as well. But it's really about that wound care and the direct care that they receive in the home. So vital signs, administering medication and injections, IV therapy, which is a big thing, pain management, and especially for those who are coming out of a surgery, post-operative care. So if someone had a hip replacement, you would have a home care nurse to be there to help them manage and deal with their medication. I should say there's also another aspect, health education for patients and families. That's one of those things that's very, very important. A lot of caregivers, they're being asked to do more now. And part of the role of a home care nurse is to serve as an education, as a bridge between the patient's family and the hospital care system, which I touch on a little bit later. So there are a few differences, just as this, I won't dwell too much on this chart, but it's basically a good snapshot of the key difference between home care and community nurses. Community nurse is much more broad. Home care is much more specific. Direct care at the person's home for home care. Well, community nursing often does serve the wider community when you think about it. They do service individuals, but the focus, I think, for community nursing is really for the wider community, especially when it comes to education, prevention, immunization. Especially during COVID, we realized how important that was. And of course, community support. Their goal is to improve public community health for community nursing, such as vaccination campaigns and school health programs. Well, for home care, it's really about, like I said, those individual care programs for the family. So dressing changes, IV, and monitoring chronic illnesses. In many ways, I would say home care nursing is really a subspecialty within the community nursing stream because it delivers healthcare directly to the person's home, but they both have similar goals, providing patient-centered care that promotes independence and quality of life. So similar goals, different ways of accomplishing them. So what does it mean in terms of home care and community care in a caring touch perspective? I've got a few case studies we have where we did for some of our nurses for home caring in this case. So Mortimer and Eileen have been married for over 50 years. They live in the same house they bought when they first got married. Mortimer's health is in decline and he has a deteriorating health condition, which is chronic now. More worrying, Eileen now is starting to forget things, starting to suffer signs from dementia, and is becoming increasingly temperate of late, has mood swings. So the issue in this case is how to care for his wife while still managing to treat his own individual healthcare symptoms, and more importantly, helping them age in place and stay in the home, which is really, really important because when couples get split up, it usually leads to a mental health decline. So the solution in this case, what we did is what we assigned a PSW trained in dementia care for the wife, and the husband received a nurse to provide the medical care and also education to help him provide additional care to his wife when the PSW and the nurse wasn't there. So again, that role between providing care but also education for what the nurse did for that family. Another one, which is very, very important, we're starting to see an increased number of, is palliative care. In this case, this client, not her real name, but obviously an archetype here, Grace had a long and fruitful life. She's recently discharged from hospital, and after receiving stomach care treatment, she's been sent home, and she was on a very precise medication regime with a colonoscopy bag. This individual needs specialized medical care from a nurse, preventive care to avoid bed sores and infection, post-recovery activities of daily living, and possibly palliative care depending on how the stomach cancer treatments work. But the solution for this individual was to assign a nurse to maintain that care, initially for the 4-hour window. But when palliative care was needed, there would be a combination of PSW nursing provided for that individual. Because like I said, a nurse is very, very important, but it's also, again, it can't be there 24 hours, right? So there's got to be a combination that interfaculty work, if you will, these interspecializations, the words I'm looking for. The nurse and the P&W work hand in hand. So nurses obviously are very important in the healthcare system. I don't think I think they're undervalued. They really are a vital part of the healthcare system. I'm going to show you why when I say this. Moving forward, we do know the healthcare system's under stress. It's very, very funds are going to get very tight moving forward, and there's going to be increasing emphasis on how to optimize healthcare resources. So, and the nurse has a very vital role in that. When you think about when a nurse is able to deliver, a home care nurse or a community care nurse is able to deliver care in a person's home, they're not going to be going to the hospital for admission. Every bed that's freed up from having an individual be in it that could be delivering care at home is another bed that could be used for an acute care. A hospital really is an acute care situation. That's when someone, things hit the fan, things get really, really bad. You need to go to the hospital. A lot of things that the hospital is being used for right now is not really acute, and it's kind of wasteful for the healthcare system. A nurse is able to prevent some of that waste by providing the care in home, supporting recovery at home so they can actually discharge the person quicker, and not to mention also detect those complications, because sometimes when people get released, sometimes things creep up. And so by detecting it early, it prevents it from getting worse and, of course, costing the healthcare system more money. And of course, like I said, mentioned early in the presentation, they're really, really important in terms of reducing barriers to access to healthcare, whether it's from geography, income, disability, or transportation challenges. A good example we have for this in Care in Touch is, sometimes some of our clients can be morbidly obese. They can't leave their home, not easily. And as a result, they've been delaying their healthcare. So we actually able to send a nurse to that person's home to do some preliminary healthcare work, and if they're nurse practitioners, to do some limited prescribing for them. Again, that person's situation doesn't worsen, and it saves the healthcare system money and improves the access to healthcare, which is really, really important moving forward, especially when it comes to an aging population that's aging in place. Access to healthcare is one of those things that is critical. And also, I would say, I know with some of our work with community advocacy groups and OHTs, there is greater awareness and acceptance that we live in a very ethnically diverse community. And sometimes people don't come to the hospital because they don't feel comfortable, because maybe they may not speak the same language. They may be coming from situations of a war-torn situation where they don't trust institutions. So community care nurses can, again, serve as that gap between that vulnerable population and access to healthcare. So I mentioned just previously about the supporting an aging population. Very, very important. obviously, as you get older, you become sometimes a bit more frail. You're more prone to accidents sometimes. A fall can sometimes lead to a more serious injury, which wouldn't normally be the case when you're younger, amongst other issues that happens with aging. So nurses being able to support seniors in their aging in place also reduces pressure on long-term care homes. I think right now long-term care homes have a wait list of approximately 40 to 50,000. They can't build the long-term care homes fast enough to fill that demand. So again, remember I said earlier when I said community care nurses will be the dominant thing. Part of it's because we're approaching the top of that demographic bubble of the baby boomers. Community care, being able to support someone aging in place is vital moving forward. Coordinated care with connecting patients with other parts of the healthcare system. I don't think I need to tell everyone here how fragmented the healthcare system is, how siloed it is. Like I said, I work with some number of OHTs in terms of they're just trying to figure out how to bring information to various caregivers and education with caregivers, and especially with the Fidelity Pathway program right now. And it doesn't do a great job of communicating and giving clients or patients the information they need and the access to healthcare. A lot of the time, there was this assumption right now, especially right now with some OHTs, that every person has a primary care physician. For new Canadians, I can guarantee you it's not the majority. The majority don't have a community care, a primary care physician. They go to a walk-in clinic, and this is where community care nurses and home care nurses can again bridge that gap, because with a walk-in clinic, it really is interruption of care. You might see different doctors. They're not familiar with your previous healthcare conditions. It's interrupted care. Having the same community nurse associated from a CHC format, where they're working, they can attend to that individual, establish a bond, establish a connection with them that is longitudinal. They got that connection over years. Really helps lead to better health outcomes. And of course, like I said, continuity of care. So we talked a little bit about the promoting health, prevention, and preventing disease. So STD, I know that in the States are going through a little bit of a surge right now, and part of it's got to do, I suspect, with lack of information in terms of how STDs can spread. I know that there was a few states that have actually declared a state of emergency on that. Prenatal and child health programs are very, very important. And of course, as we know from the measles outbreak that just happened recently, the importance of vaccination clinics and getting people the information they need to make an informed decision about how vaccinations can improve their children's well-being, right? Not to mention, health is holistic. So we also talk about nutrition and mental health education. So how important that is when how community nurses can bring that information to prevent avoidable illnesses and conditions that would again cost the healthcare system money in the long run. And of course, during COVID, we know how essential nurses were. They were the backbone of the government's response to COVID. Whether it's the testing and vaccination programs, the contact tracing, that was all nurses doing that. And the hard work was one of the reasons why Canada wasn't as hard hit as other countries. And I think that goodwill that was generated from the nursing community towards the nursing community is a testament to the sacrifice and the hard work the nurses did during the time period. So I said how valuable nurses are, but they do face a number of challenges. That is, someone's got to do with the workload right now. We talked about severe staffing shortages. A lot of hospitals are not necessarily going to full-time work for nursing. They're doing contract work or they're using staffing agencies. It's very, very tough if you're a nurse to build your life around a short-term contract. You don't really know where you're going to be going, if you're going to have a job in the future. So as a result, the uncertainty prevents labor mobility and it essentially creates a problem with the healthcare system because you've got that almost self-imposed limitation on staffing. And of course, when you're working in a kind of environment, there's a moral distress and emotional toll that's applied to nurses. Not to mention the actual job itself is very, very hard. If you're working with palliative care, especially you can imagine a pediatric palliative care, how emotionally draining something like that would be. It's incredible. And the nurses really, they deserve more credit than what they're getting. Workplace safety and violence concerns is very, very important as well, because obviously, especially with those who are suffering from dementia, there's a violent outburst sometimes. something can sometimes trigger an outburst. And not to mention the homelessness sometimes. There's a lot of people I know I used to be involved in the CHC close to St. Joe's. And a lot of nurses were struggling with that situation. At Caring Touch, we make sure our nurses are always secure, always safe. And we take workplace violence very, very serious in Caring Touch. We never try and put them in a situation where we knowingly there will be dangers. And afterwards, we make sure that once we're alluded to a situation, we don't put them into the same situation again. Travel demands, we talked about that bridging the gap in rural communities. Well, it's great that a nurse can get there, but it's very, very expensive, sometimes very difficult for them to get there. I mean, especially if you think about an Indigenous community past Thunder Bay or Sudbury, a nurse may be posted to that position for 6 months at a time, maybe even a year at a time, away from their family, away from their social circle, and that has its own mental tolls. Funding limitations we talked about in terms of for those who are familiar with the refugee population, the cost to that for the government is very expensive right now, and they're trying to recover that in terms of co-payments. Well, this has an impact on the level of care that those individuals can receive. It's unfair, like I said, those delayed healthcare, those who are receiving a delayed healthcare will eventually have to come back, and it'll be more expensive the healthcare system to treat at a later date. But that said, we are heading into a situation where optics are becoming very important, and there is funding limitations now. And like I said, that will affect the nurse as well, because when you think about, they know the person needs maybe 20 hours or 30 hours a week of care, but they only be able to be financed for 15. So that's the challenges as well. And of course, increasingly complex and diverse patient needs. As people's health condition deteriorates, it deteriorates in different ways. And as a result, we're not, what would normally be a very simple patient would eventually in 5 years become a very complex care patient with a multitude of maybe comorbidity issues. So that's something a nurse has to deal with as well. That takes additional resources and training. And of course, this is again something that's a bit of a self-imposed from the government. A licensing fee increasing. In addition, when the wage growth is slowing. I mean, obviously, we all know how expensive inflation is in Canada nowadays, the cost of living. The wage increases have not been comparable to match that inflation rate. So they're suffering just like a lot of other people, and that needs to be corrected. At the same time, I talked about the staffing shortages. Right now, in 2022, over 3.1 million Canadians were over 75 years or older. It's going to go at least double that by 2052. The need for nursing is increasing. Simple as that. And it's also driven not by population growth, but the fact that, again, community people are preferring to age in place. They're not going to the hospital to receive care. And to be honest, like I said before, hospital is not the right place for that anyways, right? So it's a case where, unlike in a hospital where they all come to one building, these people are spread out. They're spread out in their communities and their own individual houses. So that is by default requires more nursing. And of course, in terms of the backlog, there's a huge backlog of what we need for nurses right now. You can see right now there's a backlog of approximately 26,000 additional nursing spots required. I can guarantee you that's probably an understatement. It might be double that. And as the demographic bubble continues to getting ready to burst, that demand for nursing will only go up. So the government is aware, and like I said, I do work with a number of OHTs. They are aware of the challenges facing nursing, and they're kind of working on. You can see that it does work, it just works slowly. But you can see right now, since 2022, they announced $1 billion over 3 years for community care services. Again, they realized that was not enough. So they accelerated that. They brought another $569 million, $300 million for wage increases to solve one of those challenges. Again, not enough. I mean, some of those backlog that was created through underfunding the system has created this huge backlog. It's kind of like when we talk about infrastructure for roads. The cities are delayed building the roads and the potholes and everything else. It's the same thing with the healthcare system. They're working on. They're working on increasing, the funding, but it needs more. And I do hear from some of my partners in the government in terms of There is this awareness of increasing funds, but you can just see that just in 4 years alone, they basically have put in an extra $4 billion. So it's a lot of money. It's a good first step. But again, we saw that demographic pressures. It needs to be more. But I could say that money was successful in reducing the wait list for patients for home-based personal support. So it is working. We need more at this point. And of course, there was the program for the community commitment program for nurses. Now, this is for publicly funded nurses. We were not able to take advantage of this. But again, you can see where those people would be working home care and community care agencies, long-term care homes, hospitals, primary care organizations, and it applies to the full gamut of nursing. So there is, I do think 25,000 might be too little when you think about just in terms of the cost, the licensing fees, and everything else. But at least it's raising awareness of the problems facing nursing, and it does kind of give some of the smaller companies an ability to take on additional nurse. Because I think that's another aspect to discuss is that, we often think of these big firms like Bayshore, but it's really about for home care and community care. It's the small companies. They need that additional help. So that's why I'm saying 25,000 is good. Would be better if it was for more and to broaden it to private care as well. Because I said there isn't the government when it comes to community care and public funded sources, it's limited. There is an ability for private care companies to serve a role. So let's talk about the future of nursing and Ontario healthcare. So demographic pressures and funding shortages will lead to the demand and this necessity for increased efficiencies and optimization. We talked about expanding community services, vital. We talked about the increasing emphasis on cultural diversity. So having nurses that speak multiple languages. So when you're perhaps applying for a caring touch, stressing that you know multiple languages is really important. We talked about the importance of dementia, how important that is going forward, right? And how there's going to be demand for that. So if you've got community care experience plus dementia, you speak a different language, you've got cultural sensitivities to those other smaller, maybe newer communities that are coming in. For example, I know Farsi, Horn of Africa languages are very much in demand nowadays. There was the Ukrainian components coming in, and also the ones coming from America, the Spanish-speaking components. Very, very important moving forward. Now, I should also say that the healthcare system may not be the most responsive, but it does recognize the importance of technology. So we talked about telehealth and virtual care. I know that teleradiology, for example, is one of those things that's grudgingly becoming accepted in the healthcare system. But it's even just in terms of spreading information to those caregivers. We talked about that before. How does the caregiver get that education? So one of those things, one of the groups I'm working with is working on how to get information in a culture sensitive fashion to some of those more ethnically diverse communities. I know in the past, Melker and I worked with a community for the Spanish-speaking nurses, the Spanish-speaking community in Toronto. And we worked with the City of Toronto Health in creating Ya Estoy Aquí, is the name of the pamphlet. It's a pamphlet that if you're Spanish-speaking, you pick it up, it gives you information in terms of, a variety of things, healthcare, neonatal care, jobs, like how to find jobs, how to get housing. So it's because, like, again, healthcare is holistic. It's 360. It's not just primary care. And I think this is also very, very important as well. When I talked about the education of caregivers, there's a latent acknowledgement that caregivers will have to do more. If you're giving them the tools, if you're giving them the education, there'll be a tacit acceptance that they'll be more responsive, they'll be doing more work in terms of taking care of the loved one. To a certain extent, that's almost implicit because of the fact that there's a shortage of staffing and nurses. So when you think about just in terms of a person's weeks, maybe they need 24-hour care, 7 days a week. They may qualify for, say, 30, 40 hours. Well, over the other hours, it's going to be the caregiver who's going to be doing the heavy lifting. And it's just kind of with daycare, we talk about daycare in Canada, how expensive it is and everything else. A lot of the time when it comes to daycare, it's the family, the individual mom and dad who are doing the work, or the extended parents, the grandparents. They're just that's that same kind of format is going to be happening in healthcare and especially senior care. And of course, we talked about health equity, very, very important in terms of reducing those barriers, but also mental health. Very, very important. I can guarantee you after this little tidbit, during every recession, whether it's 2008, the dot-com, the jobs recovering from the 90s, there's always been a spike in mental health cases. People, whether it's depression, suicide, you name it, there's a knock-on effect. And it's very, very important coming forward. We're coming out of it. We're still in a deep contraction, economic contraction. There will be increased demand for mental health, especially with increased awareness of what mental health is and the importance of it. So let's talk about Care and Touch in terms of what we look for. I kind of touched a little bit about this in our presentation in terms of what we're looking for in terms of the skill sets. We hire the full gamut of nurses, so RPNs, RNs, nurse practitioners. And we look for certain kind of hard skills. So obviously the CPR and basic life support, the ability to know how to medical administration. Later on today, you'll see in the room downstairs our training facility. It's got a full mock-up for mannequins. So for those who need additional training in terms of how to administer medication, IVs, stuff like this, that kind of thing is very, very important, and we're able to train for that now. But we'd like to see you at least have that knowledge as well. Clinical knowledge and important, infection prevention and control, IPAC. We just went through Accreditation Canada. We got a 92% on our primer. We're now in the Q momentum phase. So for those who are not aware, Accreditation Canada is the same accreditation standards that the hospitals use. And one of the big things about that was about IPAC. So very, very important that nurses that we hire practice it as well. And of course, documentation and electronic medical records. Documentation is vital. When it comes down, when you don't report it, you don't record it, it gets lost. When it comes to think of the role of the nurse, we talked about monitoring a person's conditions. Documentation is vital. And it's also a case where it's the first warning sign when something's going wrong. We talked about when someone gets discharged from a hospital and we're monitoring them for complications. That shows up in the documentation. Oh, 3 days ago, you started not eating so much, started to have a high fever. That's the warning sign that the primary care physician later on in the hospital can use to properly diagnose or to be aiding in the diagnosis of that individual. So documentation is important. We also stress soft skills, guys. This is very, very important as well. You can't learn these in school. Critical thinking, great judgment. A nurse, the best nurse I've ever known is the one that could almost sense what was wrong with an individual. And that comes from years of experience and being aware of different scenarios and what's the most common outcome. So fitness, again, you're going to be on your feet a lot. You're going to be working, you're going to be running around a lot. Being physically fit is important. Being collaborative. No one there's a lot of superheroes when it comes to nurses. But imagine how powerful you can be when there's a group of nurses working together toward one shared common goal. Professionalism, demeanor, judgment goes without saying. Compassion. I want to talk about this for a sec. Nurses come into a person's life when they're at their lowest. Okay, they might be charged from a hospital. They're feeling despair, essentially. Things are not looking good. The role of a nurse is not just patching up their body, it's patching up their soul. The ability to create an emotional bond with someone to bring light to that darkness, hope to that despair is vital. And it's one of those things that make nurses so important to our healthcare system. And again, the ability to communicate, I should say, to your client in a way that they can understand. We've all gone to a doctor. You ask the doctor what's wrong, and they tell you in gobbledygook what's wrong with you. You don't really understand what it is. You're saying, like, I need you to tell me what's wrong. What do I need to get better? What's going on here? The ability for the nurse to act as an intermediary between the primary care physician team and the client is vital. You're almost essentially translating sometimes in more ways than one in terms of language as well, what's the information they need to get better. And the ability to do that in a way that is recognizing your client's needs is very, very important. So let's talk about just a little bit about the checklist we have. Obviously, we kind of expect people to have a vulnerable sector check before applying. Medical clearance, so TB, test within 2 years that's recent, X-ray results, immunization records. You're working with people who are very vulnerable. Have your immunization done and ready and current. Education certificates, obviously very, very important, or your in this case, your degrees for your certificate for whether it's international or domestic. And for those who are coming from overseas, your ability to prove that you're able to work legally in Canada, right? There's been a few times where we've had to say no to somebody because their PR status, or not PR status, their work permits was just on the verge of ending. And it's kind of like, should have been done earlier. You shouldn't be, don't tell us we had to, like I said, we had to say no to that person because they weren't legally allowed to Canada. And if we let someone work, it's a very, first of all, it's not legal for one thing. And second thing is it's a liability issue, right? So why work at Care and Touch? I'm going to be honest, it's fast paced. There's a lot of work. You're going to be on your feet a lot. You're running around a lot. That said, we are very horizontal. We don't like using big titles. Everyone is basically, no current managers. We work very closely with the team. We work very closely with the clients. We try to make sure that the gap between us and the client is very minimal. Flexible work schedule, we do have that. I mean, if you need time off to take care of a doctor's appointment, or if you need to take care of your children, for example, we can do that. We do have high standards. Like I said, we're accredited now. So we do expect anyone who we take on to enshrine and follow those standards. There's a lot of things which might be acceptable in some of our peer group or peer competitors, but we don't accept here. We expect the best, and we hire the best, and we promote from within, because that's the thing. We've already gone through a vetting process with those people. We know what they're capable of doing. And we prefer to hire from within because those people have already proven themselves. They know the culture, and it's also another way of, like, again, boosting employee morale. This isn't like it's a dead end job. This is a place where you can grow. So, just to reiterate how important nurses are to us, this is some of our clients from our adult day program, but in many ways, like I said, we all are together. We focus on being family. And I know you hear a company say that a lot, but in this case, it really is important. We look out for each other, we work together, spend a lot of time together. It's very, very important. So I'm opening the floor now for Q&A. I'm going to stop sharing the presentation. Oops, here we go.
Thank you, Stephen. We've learned so much from your detailed presentation. I have so many questions,
Perfect.
but then it was answered already through your presentation. And you touched various parts of community nursing that we need to know. So for sure, indeed, community nursing is important in the healthcare system because it helps promote health, prevent diseases, and provide healthcare services directly within the community. So again, when patients receive the right support at home, the chance of needing hospital care are greatly reduced. So community and home care nursing provide quality of life and improves the overall health and well-being of the population. And it's good to know for us the support that you provide to your staff, especially with the IENs, and you're welcoming them, open arms, especially and also in continuous training and professional development of your staffing. So showing our IENs that they can use their skills and experience in community nursing is very important. And we know that community nursing is the future of healthcare. So we are encouraging everybody to go explore community nursing. Again, we have observational job shadowing, a little bit of add on observational job shadowing. This is something that you can do for 2 days, observing a nurse in the community, so you know what your role. So this is something to showcase, like, is this something that I can do or I would like to pursue in the future? So connect with your case manager if you're a member of CARE. If not, please attend our information session on May 21st at 1 p.m. to get to know more about what we do and how we can support you as an IEN and flourish in the community. So, Stephen, you have somebody, one of your staff, if you would like.
Yes, we're just getting him right now.
Ready.
So it's and I just want to add to what you said before. When it comes to community care nurses, as I mentioned to the group here before, to be aware of, which what type of stream you want to get into, because there are slightly different, they're obviously the same goals, but when you think about the community care group where you're working, you might be doing speeches for large groups of individuals. You're engaged, like versus say a home care where you're forming those close bonds with individuals. Uh, Different people want different things, and I think it's very, very important. I said like a bit of a background difference between the difference in home care and community care nurses. One is much more general, especially when it comes to education campaigns, but when it comes to the home care, a lot of people prefer home care just because you know who you're going to be seeing, the families you work with, you become an extension of that family, and to an extent that has its own challenges as well, especially when it comes to practicing great judgment and confidentiality, because sometimes the lines do get blurred, and that's one of the challenges the home care nurses face. But we try to make sure that when we have a home care nurse, they understand how to deal with those kind of ethical issues sometimes, right?
Yeah.
Mhm.
And thank you again, Stephen, for that one, because not a lot of us knows that we only look into community nursing as a visiting nurse, but there are other jobs within the community that you can work. In community health center, we have partners as well. And also what you were talking about a while ago, that there's also opportunities for them to work in a community health center or running a program like mother and child, or let's say immunization clinic, flu clinic. There are different things that you can do within the community. So again, this is a good way for you to explore, because we don't want it to waste your experience and your skills. There are lots of places where you can use those skills and within the community. So again, keep your eyes open. There are lots of opportunity again in a community center, in a clinic, in home care, which is basically visiting as a visiting nurse. You can be a foot care nurse, so you have your specialization. So look into those things, and again, if you have a case manager, explore those opportunity, and also where you can get some maybe certifications and other things that could expand your skills in those areas. So should we have the testimonial, or should we answer some of the questions? We have a few questions on our QA
I've
box.
got our nurse here. You can be able to answer a little bit about.
Oh,
Here we go. His name's.
hello.
Hi.
Hello.
All right.
Good to see you again. How's everything?
Hi, everyone. Hi, Lourdes. Hi,
Happy
everyone.
Nursing
Hi,
Week.
happy
Happy
nursing.
Nursing Week. So again, so those who are who don't know me, my name is Jazz though. So I have a story to share. Are you okay with everyone? With this one?
Oh yeah,
All right,
we're
so
here. We're ready.
I wrote it down so I won't miss anything. So my name is Jazz, and this is my story as an IEN. My journey from home to waiting to finally finding the right door at the right time. So I came to Canada with dreams like many international students. I believe so. I believe this country could be a ladder to the nursing career I truly wanted. I tried to study step by step, thinking each application, each course, each exam would lead me closer to the final line. But the reality was heavier than I expected. There were empty promises, sad to say. And during that time, PSW pathway felt clearer compared to the nursing. It is in terms of immigration, actually. So I still wanted to become a nurse. I never stopped believing, but I also had to face how exhausting it can be when the road depends on timing, funding, and systems you can't fully control, even now. What made it even harder was that I did push forward. I took a risk and I paid for it with the resources I had worked hard to save while living alone in Canada. So I made three applications actually. NNES, ARFA, if you're familiar with ARFA, the one in Australia,
Yeah.
and NYZ. The worst part, the ATT for NYZ and NNES arrived in the same week. Because what I'm thinking that time is like, whoever comes first, I would go with them, right? So I don't even think CNO is free at that time. So nobody is guiding me. So I'm one of those people though, actually. So that pressure felt unreal. Then I fast forwarded, I passed, I NCLEX. But as many of us know, passing the exam is not the same as becoming a nurse in practice though. So the greatest obstacle for me became my experience gap. I wanted to be honest. I'm sorry from the bottom of my heart. I didn't know about Kier Ian that time. Even though I talked to Rodolfo back then is not even our senior president though, but I have a chance to talk to him. He gave me the reassurance that just something big would happen. But still, I felt like I was stuck in the middle of nowhere, waiting for clarity. Then Caring Touch came. So this is where I am now, Caring Touch. It's not just a company, it's a unique kind of home care where nursing and real care are connected. If I can say it simply, they are nurse managed home care where you can see nurses and PSWs collaborating, not just working side by side, but truly talking about patient centered concerns, discussing care, and learning from one another. I started working here as a PSW at the time. And what I saw changed my perspective. I handled patients from simple to complex care needs. One moment I would be assisting with daily support, and the next I would notice concerns that needed deeper nursing attention. So I remember telling Melker, he's my boss, this is something that we should be discussed. We need more nurses on the field. These situations will be a big help for IENs who lose their confidence in their practice in this new country. So looking back, before I became one of the nurse managers here at Caring Touch, I realized something many of my staff were IENs. People who are carrying the same struggle I once carried, hope in one hand, uncertainty in the other, and the same time, Milker keep pushing me toward to getting my license. He keeps saying, the harvest is plenty, but the workers are few. Back then, SPIP didn't exist yet, SPAPME. So I still had to go through the hard process of activation and completing steps to return to my back home, Philippines, and return as fully registered in CNO. So that's the process I went through. This is the story is only the beginning of many stories. Many of our staff once were IENs, have now transitioned to RNs. And yes, I will say this clearly. The SPEP now didn't make everything easier, but at least the tunnel feels shorter. So at least there's a hope though. With the program and the support system in place, it feels less like being alone in the dark and more like walking toward a light with guidance. Today, as a core member of the nursing team, I see that our needs keep evolving. What I used to think nursing is only at the hospitals, it's not true. Nursing always started at home, where the patient is not yet sick, where prevention matters, where care makes the difference before things get worse. And so, as Melga said to me 3 years ago, the harvest is full, but the workers are few. So, to everyone at Caring Touch, thank you. Thank you for seeing the future in people like us, for giving support where we once felt stuck, and help IENs become a full-fledged nurses. This is my journey, God's timing, and Caring Touch mission, and I know it's going to be a part of many journeys to come. That's my story, Lourdes.
Thank you, Jazz. Thank you so much for sharing your journey. Amazing, right? Like you just pursue, like you just like, keep yourself motivated. And that's, I think, for all our IENs. It might be hard at first, but there's always hope. Look at the people that you're seeing now during our presentation. They were once in your spot, in your place, but they persevere. So and also gravitate to the people that could help you. There are a lot of people like that out there. So always be positive. Rola, go ahead.
I want to thank Jess. I had the opportunity to meet Jess in person to the grand opening of Caring Touch new location where our IENs now are enjoying the two sessions, hands-on and training. And Jess, I would say it is sometimes actually unfortunate that many IENs do not know about Care Center early in the journey, but now we are pan-Canadian pre-arrival to post-arrival. We've been there from 2016 through our past program, and I see Megan Wankel, who is the program manager for the pre-arrival to post-arrival. So we always have those kind of success stories when IENs learn about the system and what to expect and how to prepare through our pre-arrival program. So I'm happy you mentioned this, that if you knew before about how to navigate the system and what to be prepared for, would have actually kind of saved all the kind of the barriers and the challenges that you went through and faced. And the other thing is the kind of open-mindedness of just let me start and be in an even unregulated position in the healthcare system helps to build those kind of understanding and familiarity. And as Lourdes mentioned, we have our mentoring program, and we encourage all our IENs to benefit, whether from the observational job shadowing or our virtual mentoring. For the SPAP, I would say proudly, and I have the lead here in front of me on the screen, the Ruth Wojcik the Wise, who pioneered this work and then was rolled out as the supervised practice experience placement or program to the CNO during COVID when everybody was kind of locked and there were no opportunities even for what you already mentioned, just to go to their home country and to refresh their evidence of safe practice, the EOP as a requirement to actually complete their licensure. But again, we kind of welcome IENs to Canada, and we're happy to support in actually integrating into the system through the programs like SPA or our workplace integration program. And Ruth, I will actually put you on the spot if you would like to add anything, because I don't want to be the one speaking about your actually leading this initiative and innovative kind of work that led to the SPAP and maybe more other things coming on our way to help and support IENs.
Well, I think it was, COVID not only was a challenge, but it presented us with many opportunities as well, Rola, and that was really the context in which we introduced what is now known as SPEP. And I think we constantly work with our regulatory body and our government funders to look at ways to help nurses meet that very critical component for registration. Because as we all know, the process can be somewhat slow, and sometimes nurses are then out of practice by the time they've actually met all the other requirements. So we constantly are looking at that because we want you here, we need you here, we want you to stay. It may not always feel that way, but it is that way. As I say, we need you, we want you, and we need you in the community. As Stephen mentioned, this is a growing area of practice. As the population ages, and as folks like me age, we would prefer to age at home as opposed to a facility. So we need you in the community. And I was a community nurse for a long time. And I have to tell you, it was one of the most rewarding practice environments I've ever worked in. It's a chance to truly provide holistic care. You not only look after your patient, but all the situations in which that individual lives and functions. So you really have opportunities to help them really look at their healthcare status and just make it the best that you can. So bravo to all of you working in the community. Please continue to do that. And I'm, someday I'll look forward to having you come to visit me.
Thank you, Ruth. Thank you, Rola. Thank you, Jazz. There's not much questions on our QA box. I think it's been answered already. But we're so grateful for this presentation, and thank you for the testimonial as well, Jazz. For those individuals, I know there's lots of questions. How can we apply at Caring Touch? If you are a member of Care Center, please connect with your case manager and we will help you with the application. We'll make sure that your resume is good to go. It's up to up to our standards, making sure that it looks great. You have all the skills to show and highlight, and then we'll forward it to Caring Touch. And also, if you're not a member, please join our next information session, May 21st at 1 p.m. Can be accessed online or be in person. Please register. Just go to our website, and I think it's already on our chat box some of the information of our website. any last, because of the timing, it's 11:16. I know there's still going to be an additional 2 sessions later on with Caring Touch for the virtual as well as the pre-screening. I know it's going to be a busy day. Stephen, anything that you wanted to say before we close?
Yeah, I mean, obviously, I would, if there's anyone has any questions about the community care or in terms of Caring Touch in particular, by all means, this is the right time to ask, right? But I just want to say how grateful I am to also be here, be able to do this presentation. Like I said, nurses, the backbone of the healthcare system, so important. So, anything we could do to help Carrie Ian and help nurses in general, I'm always here for you guys. Oh, there's
This
a
is
lot of
not
hearts
gonna
here.
be this is not gonna be the last time. We will connect with you all the time. We know that, Stephen. So
That was a lot of hurts. I'm blushing now.
there you go. More hearts. For sure, like with the virtual thing that you're gonna be doing, the Alzheimer's or dementia virtual tour will be a hit for our clients, and I know we're gonna be asking you to do it again
Yeah,
for our,
it's quite intensive. It's developed from Second Wind, which is one of the standards for dementia training. So
so that will be
That's great. That's
exciting.
great.
Yes. And thank you again for supporting us, helping us, and again for always supporting our IENs. And thank you again to all who attended today. Join us again on Friday for day 4 of our another exciting and knowledge-filled session. We would love to have you again. So enjoy the rest of your day. For those IENs who are at your location, enjoy your 2 sessions, and we would love to hear from you. So email us, let us know what happened. And again, we're so happy that you're here. Stephen, go ahead.
just one more quick thing. I did send you the copy of the presentation, so
Yes.
that can be distributed to the people who are joining online for their review or consideration at a later date.
We will send it to them. And again, thank you so much, Stephen. Have a good day. Happy Nursing Week, everybody. See you on day 4 on Friday. And enjoy your day. Take
Happy
care,
nursing week.
everybody.
The nursing week. Thank you.